Hello friends, in this video we will discuss about the abdominal hollowing and abdominal bracing exercises and the comparative study in between the abdominal hollowing and abdominal bracing exercise. Whenever we comes to the rehabilitation of the low back ache, the first exercise which is prescribed is the lumbar core strengthening exercise. In that, the abdominal hollowing and abdominal bracing exercise come in our mind first. Okay, so basically it's create confusion among the patients and also among the students. So today I will discuss all the concept behind abdominal hollowing and abdominal bracing exercise. So please go through this video and prepare your own note to understand this topic. Okay, now we will discuss about the abdominal hollowing exercises. Okay, so it is the method of contracting the deep muscles of the abdominal wall. Especially it is transverse abdominis muscles. So what is the procedure? So patient has to be there in hook line position, then therapist has to palpate medially to the anterior superior iliac spine, okay, to see the contraction of the muscles. Then patient should be instructed to do indrawing of the belly button towards the spine, okay, and hold the contraction for few seconds without holding the breath. Okay, so the progression of this exercise can be done by moving the extremity with abdominal hollowing or performing abdominal hollowing in different posture. Okay, basically it is in kneeling position, half kneeling or quadruped position. So abdominal hollowing exercise also prevent excessive lordosis. Okay, and also it is used in performance test. Okay, now we'll discuss about the abdominal bracing exercises. So it is the method of contracting isometrically all the muscles around the lower trunk. Okay, that is external oblique, internal oblique, transverse abdominis and erector spinae or multifidus muscles. Okay, so what is the procedure? So patient has to be there in hook line position. Okay, then therapist has to palpate all the muscles around the spine and abdomen and spinal muscle. Okay, palpate. Then the person is instructed to demonstrate the concept without abdominal hollowing and expanding their abdomen. Okay, then therapist has to palpate the rigidity around the abdomen and the spine. So in one more way, the patient can be instructed like this, like a patient should be instructed asked to don't allow me to sink my finger on your abdomen, contract your muscles and don't allow me my finger to sink on your abdomen. Okay, so the instruction will be given like this. So what is the progression of the exercises? Progression of the exercises, like it can be done in other activities or it can be done in other exercise program. Okay, progression with the activity and with exercise program, other exercise program. So many study has been done to see the comparative study in between abdominal hollowing and abdominal bracing exercises. Okay, so many article has been published. I have gone through few journals which I am telling, that is Journal of Physical Therapy and Science, Journal of Sports Science and Medicine, Journal of Orthopedic Sports Physiotherapy and International Journal of Sports Physiotherapy. Okay, so according to all this journal, okay, firstly the EMG study shows that okay, selective single contraction of transverse abdominis occurs in abdominal hollowing. Okay, in abdominal hollowing, the selective contraction of transverse abdominis. But in case of abdominal bracing, okay, all the muscles around the lower trunks contract. That is superficial and deep muscles. Okay, so one more study shows that so increased stiffness around the spine from abdominal hollowing is significantly less than abdominal bracing exercise. Okay, it is due to the decreased activation of remaining muscles around the lower trunk. Remaining muscles around lower trunk. Okay, one more third study shows that when sudden perturbations force is introduced, the abdominal bracing produces greater co-contraction of muscles. It produces greater co-contractions of the muscles, increases the trunk stability, provide better resistance for lumbar displacement as compared to the abdominal hollowing. Okay, so one more study shows that co-contraction of transverse abdominis and erector spinae provides vital muscular stabilization of lumbar spine, but selective activation of transverse abdominis in abdominal hollowing decreases the rotational trunk stability. Okay, so in abdominal hollowing exercise, it decreases the rotational trunk stability. Okay, and despite of all these things, abdominal hollowing provides symptomatic relief, kinesthetic awareness, and motor control education in acute phase of low back ache rehab. In abdominal bracing exercise, it provides effective technique for improving spinal stability during physical activity. Okay,